Hello, my name is Emily Evans, and today I'm going to be talking about my capstone project, which covered the discrimination and implicit biases that take place in the healthcare setting. So, to begin, I wanted to start off with some background information and the significance of the problem. So, discrimination is a problem that has occurred for years and years throughout the world, and especially in the United States. And what a lot of people don't know is that discrimination does contribute to a lot of health disparities that are seen among minority populations. Some health disparities include high levels of stress, which can contribute to the development of other diseases, reduced participation in healthy habits, as well as higher mortality rates. So, really, what I wanted to do with this project was find out what the influence of the healthcare provider was on the development of these health disparities, and also what kind of discrimination happens between the healthcare provider and the patient of minority status. And then, as for discrimination in public health, these factors right here were kind of the core areas I wanted to find a lot of my research about. And that includes the minority groups with regards to race and ethnicity, gender and sexual orientation, socioeconomic status, age, disability, and more. I also wanted to talk about implicit bias because it does relate to discrimination because it is defined really just as the unconscious feelings that a person has that are prejudiced. And a lot of times people don't know they have these feelings, yet they can kind of act on them when they don't really mean to. They can be positive or negative, however, whereas discrimination is typically only negative. And it can be tested with the implicit association test, which is an online test that you can take whenever, and it really just tells you where your discriminatory feelings lie. So, for my methods and the description of the survey that I conducted related to this project that I did for Capstone, um, included the comprehensive literature review, which for this topic in particular, there were a lot of resources, which is a really great thing, but it was hard to kind of key down on what was the most important things to find. So, the way that I did this was that I had the three topics of relevance, date, and area of study to help me determine which ones were the ones that were good enough for me to be able to incorporate in my study in particular. So, as for relevance, this consisted of me using specific keywords that were found in the articles. And these keywords included discrimination, healthcare, prejudice, health disparities, race, gender, sexual orientation, socioeconomic status, and implicit biases. So there was a wide range of studies based on those keywords, but it really did help in kind of finding the ones that were most relevant to what I wanted to find out. And most of these studies did occur in the United States. However, I didn't want to exclude international studies completely, just because discrimination in the healthcare setting, which I found did occur across not only the United States, but across the world. And I thought that was important to include as well. As for the date, I did have a flexible range of dates just because through my research, I found that this problem has occurred for a really long time, and I wanted to make sure I highlighted the significance of this problem in terms of it being something that has been happening throughout history but still occurs today. So I thought that including earlier studies would help highlight that. And the earliest study that I included was 1978 because my cutoff was at 1975 as the earliest inclusion of a study I would have. And then for my area of study, I used peer-reviewed journals that were really relevant to the areas of public health, medicine, or psychology. These peer-reviewed journals were mostly had primary sources. However, there were some secondary sources that I did use in the instances where I couldn't find a primary source for that area of interest. These peer-reviewed journals were all found on Google Scholar database, and the only sources that I did use that were not peer-reviewed journals were reliable sources such as the CDC, the American Psychological Association, and the United States Census Bureau. And then for my study, the survey that I conducted was online through the SurveyMonkey platform, and I included questions that I derived from my review of literature as well as personal observations that I had in my time as an intern. And the purpose of the survey was to obtain generalizable results. I didn't have any like statistical test or anything I wanted to run. I just wanted to get a survey and some feedback from a population. And then a little bit more about my study. I was influenced by the topic of discrimination in healthcare because I was an intern at St. Mary Health Center, which is a nonprofit clinic for the low income population. And I wanted to originally ask them to do my study, but due to coronavirus, I was unable to conduct it there. So the population in my study was the general population on the internet. Everybody was voluntary. They took it on their own time, and the results were anonymous. There were 38 total respondents as well. And really, it just helped me examine what types of discrimination are present in the healthcare setting, and if these results compared to the results of the previous studies that I had in my literature review, and if the minority groups were the same among my study as well as previous studies. So as for my results and findings, for the discriminatory populations that I mentioned before, with regards to race and ethnicity, I found that African Americans and the Hispanic Latino population did have the highest reports of experiences in healthcare being discriminatory. There was one study that found 36.9% of Puerto Rican Americans felt as if they were discriminated against in this setting, in addition to having feelings about their provider withholding information from them, which I thought was interesting. Another study actually found that non-white groups that were surveyed reported that they felt as if they would receive even better care if they were white. So then for gender and sexual orientation, women and the LGBTQ plus community were the most subject to experiencing discrimination in the healthcare setting. And studies found that women were actually susceptible to receiving completely different treatment and care for the same diseases when compared to men. And I also found that many physicians are not educated on the transgender population. And this can be serious because many transgender patients don't want to tell their provider that they are transgender because they feel as if they will be biased against because of that factor about them. And another study was actually really interesting and sad because 2% of the respondents in that study said that they had reported violence in the healthcare setting against them. And then as for socioeconomic status, low-income populations are much more susceptible to discrimination in the healthcare setting. And studies that I found said that physicians were more likely to perceive patients of lower socioeconomic status as less intelligent or having less ability or personality in a more negative way, and that they had less desire to be healthy when compared to the rest of the population. And then for implicit bias, a significant finding I found is that the Institute of Medicine actually recognizes implicit bias as playing a large role in healthcare discrimination. And this is important because it really does influence the way that providers make their treatment decisions for patients, as well as it affects their interpersonal skills and relationships with their patients. Additionally, I found that some patients actually go into an appointment with an implicit bias as well, which can cause even further complications in the clinical setting for everybody involved. And then for my study, 73.6% of the people who took my survey did not experience healthcare discrimination, which was expected. But what was interesting that I did find in my study was that discrimination did still occur significantly, even though it was a really small sample size, as well as the discrimination was measured among a variety of demographic factors, including race, gender, and socioeconomic status. So really my study was able to highlight key factors that I found a lot of information for in my review of literature too, which is really interesting to see. And then this is just an example of one of the questions I had. And you can see that there is still, a really big difference between the response rates, but there is significant evidence there that people are discriminated against in this setting. And then as for the recommendations and conclusions, On the individual level, I think the most important thing an individual can do is to come to terms with the thoughts and feelings that they have that may be discriminatory or prejudiced in order to reduce those feelings. And it was also suggested in the literature that if someone focuses on the discriminatory factor instead of just kind of the whole situation as a whole, it's easier for them to learn to not notice it as much. Additionally, self affirmation, which is essentially kind of punishing oneself uh, in your head by not keeping the integrity that you have to not be prejudiced and not feel these thoughts, can really be a really influential factor on reducing the rates of discrimination that someone might feel. And then for the greater scale, with regards to more of a public health approach, health equity in education and understanding the many determinants that go into health and can cause health disparities, especially among minorities, is really important to emphasize in education for medicine or any kind of person who's going to work with people in healthcare, um, as well as research interventions that occur at different levels. And this includes even policymaking at more of the government level versus really like small baby steps that happen at a private practice. Wherever it is, all these things need to be addressed at the different levels in order to ultimately reduce this problem to a significant extent. And then in conclusion, addressing this problem can diminish its prevalence and it can provide the best quality of care. And the good thing about discrimination is that it is something that is within people. So as long as the individual has the effort and the education and the awareness about this topic, it's a lot easier for them to decrease the amount of these feelings that may occur. And then I would just like to acknowledge my survey participants. Thank you for participating. And I also wanted to acknowledge St. Mary Health Center, my internship site, for having me as an intern there. And then those are my references. And that concludes my presentation. I hope you enjoyed it.